but in an instant, you break me down.
Hello, everyone, and welcome to the Health Go Live webinar series. Today's episode is brought to you by our friends at Bowie Health. Just a few housekeeping items to go over. We would like to remind everyone that the Q&A feature will be available, so feel free to send in those questions for the panelists throughout the discussion. Stay on afterwards to experience holiday magic with mind-blowing mentalist Mark Toland. And with that, I'll throw it over to our moderator who joins us from Business Insider, Andrew Dunn.
All right. Well, good afternoon, everyone. Thanks for joining this Health Go Live panel. I'm really honored and excited to have quite the distinguished set of panelists and experts here. And we're going to get into it about the latest going on with COVID vaccines, distribution news. We'll talk about allocation, hesitancy, some of the big challenges facing this picture of coronavirus vaccines that can actually impact the pandemic we're all living through right now. So my name's Andrew Dunn. I'm the pharma and biotech reporter at Business Insider. One housekeeping note, feel free to ask questions through the platform, through the Q&A at any given time. I'm going to try to work those in real time throughout the conversation, and I'll leave some time at the end to sort of go through those grab bag style. With that said, we'll start with intros. I have a really fascinating group of perspectives here. Let's start with Dr. Tia Powell. Could you just tell us who you are and then some of your key focuses right now about the vaccine?
Absolutely. Thank you, Andrew. I'm Tia Powell. I'm a physician, a psychiatrist by training, and a bioethicist. I'm the director of the Montefiore Einstein Center for Bioethics up in the Bronx. And among my academic interests for about the last 20 years or so has been looking at public health disasters, everything from allocation of scarce resources, and now, of course, so many of us thinking about the vaccine.
Thanks. And go ahead, Dr. Louise Short.
Great. Thank you so much, Andrew, for moderating this panel. And I want to thank Bowie for inviting me to be a part of this discussion with such knowledgeable colleagues. I'm a physician and a national clinical leader for Brown & Brown and Strategic Benefit Advisors. We're an employer benefits and consulting firm. My background is really in occupational preventive medicine and particularly occupational infectious diseases, and I've worked with the Centers for Disease Control in the past. Throughout the pandemic, I've been engaged with employers in understanding COVID-19, advising on workforce health and safety, which has included control measures. Really trying to make sense of the marketplace of screening, testing, contact tracing solutions. And now I'm helping employers understand and plan for the vaccine.
Thanks. And we also have Dr. Sue Mello.
Hi, thanks for having me. I'm Susan Mello. I'm an assistant professor of health communication in the College of Art, Media, and Design at Northeastern University in Boston. I teach courses on how to develop evidence-based health campaigns and messaging using CDC guidelines. And my research examines how people process risk information, like vaccine safety, and also the role that mass media plays in affecting our decisions.
Thanks, Sue. And last but certainly not least, we have Andrew from Bowie Health. Andrew, go ahead.
Thanks, Andrew, and thanks, Dr. Powell, Dr. Short, and Dr. Mello for joining us today. Hi, everyone. My name's Andrew Lay. I'm the CEO and co-founder of Bowie Health. I'm also a physician by training. I started the company when I was still in medical school. What we do is we help people navigate to the right care at the right time, and basically helping them understand their clinical situation, and then based on their benefit or insurance information, get to the right care at the right time. For purposes of COVID, we started working on COVID in early January, updated our AI to understand COVID by early February, and have been working with different states, Commonwealth of Massachusetts, Commonwealth of Virginia, large insurance companies like United, Cigna, Humana, Optum, Express Scripts, in helping their members and residents understand what to do for purposes of COVID. And then more recently, I've been working with a number of employers in helping their employees understand whether they can go back to work or not. And if not, navigating them to the right care to help them in not being able to go to work. Excited to be here and excited to be part of the panel. Thanks, Andrew.
Yeah, well, thanks everyone. And again, a reminder, there's a lot of questions around the vaccine. Please start submitting them now. We have a few hundred people watching, which is amazing, and want to make this as relevant and helpful to everyone out there who's taking the time to listen. So start submitting questions as you think of them. I'll just start with very quickly. I'll try to summarize the state of play, and then we'll get into some of the challenges we're seeing and thinking about right now. Yesterday, you may have heard, if you have a phone with news alerts at least, there was an FDA advisory committee panel that recommended an emergency use authorization decision from the FDA for Pfizer's vaccine. Right now, we have two major vaccine programs led by Pfizer and Moderna. Both have shown about 95% effectiveness shortly after getting 2 doses of those shots. Estimates from the federal government, this is kind of unusual where this morning we saw FDA Commissioner Steve Hahn make a statement saying they are going to issue emergency use authorization. They're finalizing that. Normally an agency like that would not comment ahead of time, but due to the urgency of the pandemic, we're expecting to see that decision go final either tonight or over the weekend. And Alex Azar, the Secretary of HHS, is setting up a timeline for these first doses to start to be delivered to states Monday or Tuesday of next week. So this is all happening really quick. We're right on the verge of launching the biggest vaccination campaign in the history of the US and the history of the world, which has a whole myriad of challenges we're going to get into. And I wanted to start with Dr. Short about the question of vaccine hesitancy. We're going to get into the distribution and some of the supply and allocation questions in a bit, but the other side of it is, do people actually want to take this? And there's been a lot of talk about politicization of the process, the speed of development. What can you tell us about the pulse of sort of the American public about this process and any doubts that might be out there?
Yeah, so thanks for that question, Andrew. And, vaccine hesitancy, as you mentioned, is a potential barrier to achieving herd immunity. And what that means is it's basically a state where so many people have immunity, either naturally or through immunization, that the virus can no longer widely be transmitted in the community. So that would stop the pandemic. According to a Pew Research poll, the majority of Americans now say they would get a COVID-19 vaccine. This is in the last couple of weeks. 60% in November versus 51% in September, which is a positive movement in terms of acceptance of vaccine. What experts are saying is that we would need to have 70 to 80% of the population be vaccinated to get to the herd immunity. A recent CBS study, and this was just a little bit over 5,000 participants, it kind of broke out things a little bit more specifically, and 28% of those who responded said they would take the vaccine as soon as available. Interestingly, 35% said they'd wait to see how others do, 20% were uncertain, and 17% do not plan on being vaccinated. And there's a pretty interesting split by ethnic group. So for those who want to get vaccinated as soon as available, it's much higher among whites. 31% of the whites said they would want to get vaccinated as soon as available. Only 16% of African Americans, 22% Native Americans, and 21% of Asians, and 28% of Hispanic English-speaking Hispanics. So, the top reasons really for people not wanting to take the vaccine: they're not sure it's effective. They feel the science has been influenced by politics. They're afraid of side effects. So there's a lot to overcome in terms of messaging, and in terms of just groups that seem to have a higher acceptance. It's higher among men, those who have a higher income, urban dwellers, those who are college educated, and those who have chronic diseases. The survey, one of the surveys also asked, what are the key influencers? Like, who would you rely upon in terms of information about the vaccine? And almost overwhelmingly, most people said it was their own doctor that they would rely upon in terms of information, followed by Dr. Fauci, interestingly, and then information from CDC. So that kind of gives you sort of a broad brush on the landscape right now and what people are thinking.
Thanks for that. I'm glad to see Dr. Fauci coming in at number 2. He's been a national treasure. I think everyone, at least in this room, would agree during this year. I don't know how he does. His daily routine is amazing. He's unstoppable. Sue Mello, I wanted to bring you in as far as thinking about taking this a step forward. How do we start building back some of the trust? But we're figuring out these numbers in real time, and I think there's a sense when we go from a theoretical vaccine to a real product, we might start seeing more people come around to it as they hear more about it. But there's this broader movement that we have the anti-vax movement and then also the hesitancy. But can you go through some quickly, the do's and don'ts of how we should be talking about these vaccines to instill trust and level with people, and what you're seeing out there, both from governments and also an employer standpoint?
Sure. This is a huge undertaking from a communications perspective. As everybody says, this is an unprecedented situation that we're facing. So what do we do? In our last conversation, we talked about whether or not the CDC was planning a national campaign to communicate to the public about vaccine confidence. And after a little bit of digging, I found out that they're actually not. And at first that raised some red flags for me, since we discussed that maybe the CDC has to have a larger role and a louder voice in messaging. But I started to think about the theory and research behind vaccination decision-making. And it turns out that I think that their strategic framework, which they're calling Vaccinate with Confidence, rather than directly addressing the public, it's more of a macro level intervention. And this speaks directly to the evidence that Dr. Short was sharing from survey research, is that people trust their own doctors most. So their strategy, the CDC, is to provide care providers with as much accurate information that they can for having those difficult conversations with patients about vaccine hesitancy. So what those conversations need to look like, they need to be empathetic. I think what the anti-vax movement, what we know is why, part of why they've been relatively successful is that they've listened to people's concerns about side effects, about their fears and their worries. And doctors need to make sure that they do that in response to and employers with the COVID vaccine. They need to be transparent. Based on CDC guidelines, we need to tell people what we know right now, what we don't know, and when we will know that information.
Yeah, and I wanted to bring in Andrew for Bowie's perspective here. Kind of a two-part question here. I'm wondering, when you think back to this year in totality, I think communicating science in real time has been a mammoth challenge, especially with patients and figuring out what are the treatments available? Are they effective? Can I get access to them? And I know Bowie does a lot of work sort of connecting patients with this healthcare system in the US. And I'm wondering your thoughts on what you've seen this year. And then secondly, how are you thinking about Bowie's role in the vaccine rollout, as far as where does warp speed, which I think we're all familiar with, the federal government's coronavirus vaccine initiative, that primary focus seems to be basically, getting the vaccines from freezer to dock, securing the supply, getting them to states. What happens beyond then, as far as, what do employers need to keep in mind, the role of states there, and where you see Bowie fitting in? So that's a many-part question, but I'll let you take that.
Yeah, starting with the first one, Andrew. I want to give a shout out to our own internal clinical team. We have physicians that work, full time at Bowie, constantly, trying to improve our AI and keep things up to date. It was a huge challenge to keep up with the science. I think at one point we saw, and this was only in April, that there had been like 23,000 pieces of primary literature written about COVID over the last since the pandemic has started. And it was the biggest bloom of primary research in history. And to imagine trying to keep track of all of the things that was coming out in the research, it was extremely difficult. And so on our clinical team, the work to take what the research was showing, take what the CDC was saying, square those two things, because those two things may or may not be congruent, right? And then also work with our expert panel of experts that were helping us with the with COVID. We were triangulating those things, on a daily, weekly basis to make sure that the information we were giving via our AI navigation product was up to date for COVID, which to this day, as we are now helping employers reopen and help employees understand whether they can go back to work or not, is continuously a challenge and an uphill battle. As we start thinking about the vaccine, what the role that we were playing for COVID was really two parts. It was first giving people the information they needed to make a good decision, and then helping them with the logistical challenges of figuring out where testing sites were, which doctor to call. Even within the test site, is there availability at that test site? With the vaccine, what we're really struggling with is understanding what our role is relative to what the states are doing, what the federal government will be doing on behalf of the employer. And we're also struggling to understand exactly what the employer feels like their role is going to be within this entire ecosystem as well. And as such, I think we're starting to move away from the idea that we're going to be helping with the logistical challenges, given that we think that the coordination of that is going to be much more centralized than at the employer level. But where we see we could be very helpful is on the education side. And so we've actually been working with Dr. Mello. And as we think about the differences in vaccine hesitancy that Dr. Short highlighted, the different, why African Americans are less likely to be receptive to a vaccine relative to white Americans is different than potentially why men are more likely to be receptive to the vaccine relative to women. And as you think about all those different splits that Dr. Short gave, our opportunity is to change the education that's given to an individual based on what we know about them, such that they get the facts presented to them in a way that resonates with the issues that might be kind of underlying their decision-making process. So, that's where we think we can make the biggest impact when it comes to the vaccine, and it's what we're focused on.
Yeah, and it's very fascinating as far as I can sympathize with that as a member of the media, of how do you communicate this complex info that's changing. With Operation Warp Speed, it's honestly every 12 hours or so. I feel like we're seeing new figures on the logistics side, but distilling that and getting that to people in a way that they can trust and value. Dr. Powell, I wanted to bring you in on some of this as far as, especially cognizant of the title of the talk here, of employer strategies and how employers can think about vaccines. Because, it seems like there's obviously going to be a massive role here for public health agencies. And Sue mentioned that the CDC, as far as, how important it will be to see how they communicate to the public about the vaccine. But I wanted to ask you more, from an ethical perspective. These first vaccines are going to be under emergency use authorization, not a full approval, which I know limits the companies in a lot of ways about how they can talk about them and market them. What should employers keep in mind about these vaccines are going to start to be rolled out to tens of millions under an emergency use that's not full approval? How should employers be thinking about talking to their workforce about these vaccines?
It's Andrew, thank you for that question. It's really a hard one. I mean, this is a really tough task for employers. As a psychiatrist who thinks about ethics issues, I'm sort of try to be very sensitive to both sides of that coin. You need to be building trust, and you do that in two ways. One is the rational piece. You need to give people the best information that you have. And as Dr. Mello was saying, you need to tell them also what you don't know. So I think there needs to be very clear messaging, as transparent as you possibly can be. But there's also the question of, we are not, the economists had it wrong for centuries. We are not rational actors exclusively. We act on the basis of our heart as well as on the basis of our minds. You need to let people feel that they can trust you. And that has to be earned. So partly that comes from transparency, from admitting in medicine, in teaching medical students, we talk about clinical humility. Don't go around telling people you know stuff when you don't. This is a disastrous approach. And the same thing is true for an employer. So on the one hand, at a practical level, I would say, absolutely tell people what you know. It's true that the vaccine was completed quickly, but it's also important. Listen to our man, Dr. Fauci. No step was skipped. They just had a lot more people working on it. And really the best minds in the world have been working on this issue. So that's in the plus column for all of us. And they have indeed come up with vaccines, plural, in record time. So that's actually really important. They didn't cheat on the steps. They didn't, not test people. But there are issues. We don't know. This is a new drug. So it hasn't been used by millions of people. And whenever you go from research to the real world, you will find things that you didn't know before. So there definitely are some unknowns. Some of those things, it's not completely unknown though. I can tell you right now that there will be people who will get the vaccine and they'll feel kind of crummy. either their arm will hurt or they'll have what feels like a sort of mild flu-like thing. And you really should tell people that. Don't not tell them thinking that that will dissuade them. They will feel lied to. And they would rightly be frightened, or not rightly or wrongly, but they may think, oh my goodness, that vaccine gave me COVID, which a lot of people do fear. It's like a vaccine is hard to understand intellectually. Wait, you're giving me some of the bad stuff to protect me from the bad thing? How does that make sense? So we do need to say, there will be side effects, absolutely. Arm could hurt, you could feel crummy, that I can tell you. I do think also this has been a tumultuous year in so many ways. We've had such a focus on Black Lives Matter, on lots of other things. I really think for my own part, and not representing my institution or anybody else, I think employers are better off addressing head-on questions about justice, about fairness, about racial and ethnic discrimination, and making clear what the policies are about how we've decided who gets what first, and that we've thought about it really hard. If you're uncomfortable with the way we've thought about it, we would like to hear from you. Not only do we not forbid you to talk, come and tell us what you think would be more fair and more just. We seek that answer and we partner with you in trying to find it. So I think ethically, shared decision-making on a choice with so many unknowables is really the sort of ethically viable path. So I could go on, and I will not, out of respect to the other panels.
Well, there's a lot. We'll get back into it because there's a lot of ethical conundrums that are just quite fascinating around the vaccine and very important. But I wanted to go off the idea of what we know and what we don't know about the vaccine, and just as background for everyone, what we know. These are highly effective shots. We don't know the durability of protection at all. The studies haven't been going long enough to know how long we'll have protection for, but the initial signs are very promising. They're about 95% effective at preventing symptomatic COVID-19. I also want to bring up another thing we know from these studies that had about 20,000 people get Pfizer's vaccine, 20,000 people get a placebo, compare the groups, see what happens. What you were just saying about sort of these expected temporary side effects, they are there. You can expect, mild to moderate levels of pain at injection site, fatigue, headaches, that should last a day or two after you get the shot. And I think it's important, to get that out there because these are 2-dose regimens where you need to go back, get the second booster shot 21 days after for Pfizer's and 28 days after for Moderna's, which is another highly effective vaccine that's happening next week at the FDA. So we get to do this all again from a review standpoint next week. Fun for me. I wanted to bring in Sue on this as far as this is kind of what I'm getting at as far as real-time science, and we're all figuring this out, is over at the UK, they're a little bit ahead. They started rolling out the vaccine this week. And what we saw was 2 doctors who had a history of severe allergic reactions to medicine or food. These are people who carry EpiPens. They had basically allergic reactions to this vaccine. And the UK health system put out a note warning no one with a severe history, a history of severe allergies to food or medicine should get Pfizer's vaccine. They're investigating this. It's still just 2 people. I'm wondering from a communication standpoint, how well do you think that's going? This is kind of the first hiccup, and I expect we're going to see many more. So how do you think through that?
So it's an excellent point because it draws attention to the power of narratives and storytelling and testimonials in communication. We know you as a reporter use them yourself, and I was actually happy to see that you published about one of the first wave of the vaccine recipients the other day and talked about how they were encouraging people to get the vaccine. So I think those testimonials in conjunction with those adverse stories are also really important so that we're not seeing statistically insignificant consequences being or overshadowing the efficacy of the vaccine. That being said, I also think it's really important that journalists remember to reintroduce those stories after everything has been worked out, after the science has either confirmed or refuted the link to the vaccine. So making sure that those stories are told again and that those potential falsehoods are debunked moving forward.
Yeah, we'll look for, I think, more clarity on that for sure. Luis, I wanted to bring you in with actually for your thoughts on what we're talking about, but also to work in a question from the audience. Keep them coming in. We have more than a dozen right now. But from Joanne Fitzgerald, Joanne asked, what are your thoughts to incentivize employees to take the vaccine? We're reviewing this now. I assume she's talking about her company. If you could answer Joanne's question.
Yeah, absolutely. So I think maybe when I think about incentivizing people, we have to be just a little bit sort of circumspect, because as Tia was saying, there's so much that we know about this vaccine. We have to share what we know and what we don't know. But in the end, it has to be an individual decision. And so people have asked, can employers mandate that someone take this vaccine? And I think, that is a question each employer has to ask their legal counsel. There have been situations where employers have been, there have been ability to mandate certain vaccines, but there's always EEOC and ADA exceptions. But there's a difference, as Tia was saying, between a vaccine that has emergency use authorization and one that does not. And so there's limitations. I'm sorry, one that has full authorization. There are limitations to what we know about this vaccine, and I think that that has to be an individual decision between the person and their knowledge base and their physician. I'll give you some specific examples. This vaccine hasn't really been widely tested in children nor in pregnant women and breastfeeding women. Now, should a pregnant woman take this vaccine? It probably depends entirely on their circumstances. So they may have a discussion with their doctor where maybe they're at home with their baby, they're not getting exposed to a lot of people, they're not out in an environment where they think they would contact COVID, although that's hard today because it's all over, but you know what I mean, versus a nurse who's a frontline healthcare worker. They may be much more apt to elect to take this vaccine. So I think everyone has to make an individual decision. What the employer really can do is provide as much transparent information as possible for people to make these choices. I hope that that's helpful. It's not a yes or a no on incentivizing, but I think a lot of employers are, don't really want to, I'll say, go toward the mandate because we don't know enough about it. And everybody's situation is different. As with any personal health choice about a medical treatment, everybody has to make their own, and drug, everybody has to make their own decision. I think something else that's
can I follow up on that with
sure.
Very quickly? I'm curious about two things as far as not a mandate, but an incentive as far as one, in response to the side effects, if it's wise, or if we might start seeing big companies offer a day or two off after you get that vaccine, because we're going to see high levels of fatigue, headache. It's basically a free comp day. It incentivizes. Second thing that comes to mind is, could companies offer money? Could a company that needs to get their factory up and running offer $500 to get that vaccine? Is that this is also getting into ethics and legal, but what are your thoughts on those as far as incentive plans? And do you hear anything like that as far as actually in the works?
So I do hear employers talking about time off if people don't feel well, and I think that this is something that they're considering. As far as giving money or other types of incentives, I mean, I think the vaccine will be covered through the CARES Act, right? So there'll be no out of pocket for employees. And right now the government's saying they're going to cover the serum, at least for the first, how many million doses that they buy, so that self-insured employers would only have to cover, or health plans for fully insured would only have to cover the cost of administration. So basically there's no cost. So I think, but as far as, kind of paying people or offering other incentives, I have not heard that yet. I think employers are more thinking, that they want to make sure that people who want this vaccine have access, that they want to educate people on how this is going to make the workplace safer. If it's a customer-facing industry, which obviously many are, for example, a retail outlet or whatever, they want to make sure that all their customers are safe. So I think it's a safety issue, and I think that most employers are posing it that way. But Tia, I'd love to hear what you think about the sort of ethics around the incentives.
Coercion is always a problem. So, it as you say, must be an individual choice. So there are incentives or incentives. If you have a low wage employee and you say, I'll give you $5,000 to take the vaccine. $5,000 is very nice for your employee, but that also could be viewed, and indeed would be, potentially coercive. So I think it's one thing to offer, calling people out, an honor roll, modest things, showing people that you appreciate that. I'm in the healthcare sector, that you, in accepting the vaccine, do this because you really care about the lives that you are trying to protect. So I think that kind of honoring and psychological reward is really important. I become uncomfortable with cash or cash equivalents as they head northward. So it's a general issue, yeah. And then there's negative coercion too. There's sort of sanctions and punishment and various things. So that's also potentially coercive. And I think, I certainly understand the impulse. I suspect that it's unlikely to really create the kind of engagement and positive uptake that you're looking for. I think if people are frightened, I would address the fear rather than threatening people. That's not going to do anything about the anxiety and fear that's underlying that. It will actually make it worse.
That helps a lot. And I wanted, in fear of getting too far ahead of ourselves here, I wanted to loop back to where we are now, which is still, we're still on the verge of this campaign rolling out, and doses are going to be extremely limited to start. According to Warp Speed officials, we should see 2.9 million doses going out from Pfizer's vaccine next week. So think 3 million people in a country of 300 million plus. There's a lot of people who won't be able to get it. So we have a question here, prioritization and allocation decisions. Andrew, I wanted to bring you in here as far as, could you just tell us, what do we know about that as far as what has the CDC recommended, who should get the first doses? And can you go over, states are free, from my understanding, states are free to make their own decisions here. It's more of a recommendation from the CDC. What are you hearing at the state level as far as following that advice or sort of crafting their own allocation plans?
Yeah, it's good timing, Angie, because Massachusetts, I think in the last day or so, just released their strategy for allocation, and following kind of the CDC's initial recommendation to vaccinate healthcare workers, so frontline healthcare staff, as well as people in nursing home residents, followed by groups with comorbidities. And then, last would be kind of more of the general public. From our perspective, we were, before, a couple of days ago, unsure of how much nuance there would be in kind of that middle to last group in terms of folks with comorbidities versus, the general public. And it was actually really reassuring for me to see how simple the state kind of made it for people to understand when they were more likely to kind of be in line to receive the vaccine, which, I'm quite excited about personally. I think one of the challenges as we move from no one getting the vaccine to some people getting vaccinated as early as next week. My wife being in line to be one of the first recipients is going to be things like, okay, well, now that I'm vaccinated, what is this person's, what can I do now that I'm vaccinated? And then what can I not do because I'm not vaccinated? I think that it's going to open up a totally different set of things that we need to talk about as a society, and a whole bunch of different things that we need to educate people on in terms of, I'm sure, Andrew, we're going to be talking about more about this, but like, if you're vaccinated, can you transmit the disease? It seems so, it seems so reasonable to think that if you're vaccinated that you wouldn't be able to transmit the disease. But then when you start to learn about how the vaccine replicates itself in the nostril, and that the antibodies in the nostril aren't the ones being formulated by a vaccine that's injected into the muscle. The science behind it gets very complex very quickly, to the point where it's almost like you need a medical degree to really grasp it immediately. And so it's going to be, I think, really, really challenging when we start to, again, move from that 0% to non-0%, for everyone to square what's the best way to kind of exist really day to day.
Well, I'll tell you, I've also gotten into the IgM versus IgG antibody debate, which I'll spare our audience from because that's in the weeds of immunology, which is quite complex. But I did want to bring in Sue as far as off that point of the public's understanding of this. It's going to be very complex and nuanced, and these studies were geared to symptomatic COVID-19 prevention. And I'm wondering, one, is there a risk of overhyping or overpromising on these vaccines that people think, I get the shot, I'm good to go, throw away my mask, back to the bars, let's book that trip. And then when that doesn't happen necessarily, and we try telling them, oh, you should keep wearing a mask for an indefinite period of time, all these fears about vaccines could be compounded. Is that a concern in your mind? And then how can we work, everyone in this system, the media, employers, the government, what should we all do to try to better inform people?
Yeah, that's a huge question. So we know that observing other people engaging in healthy behaviors and by normalizing those behaviors, that can be some of the most influential information that we receive in our environment. So by talking to our doctors about them having been vaccinated and what they're doing in their daily lives can be really influential to the particular patient who's going in and asking questions about the vaccine. I also recommend that you use the most plain language possible. So when you're starting to get into these conversations using medical terms and scientific jargon, the CDC actually has a scorecard that anyone could use. And if you're planning on having a conversation, whether it's with a patient or you're a journalist putting together an article, you can analyze your own content based on all of their recommendations. So taking paragraphs and unchunking them into bullet points, by removing scientific language and putting in plain language, by addressing both risks and benefits in quantitative and qualitative terms, how to present statistics. So there's lots of recommendations and information for people who are having either these conversations or providing information that I think people need to attend to.
I'll have to check that out and see how well my own reporting holds up. I hope it's not too jargony. Tia, I wanted to shift gears a little bit and get back to Andrew. We're talking about, the prioritization and allocation decisions that brings up some tough questions around equitable and fair allocation of these first doses. We're hearing a lot about frontline healthcare workers and nursing homes as two targets kind of broadly nationwide. And we'll see some variation there. Maybe some states throw in first responders. We'll see what happens. But, you're in one of these healthcare institutions, and I'm wondering, from an ethics perspective, what are your thoughts about, I guess, how much of that institution should be prioritized to get doses? And especially, do you get the sense that supplies, and not necessarily about your institution, but in general, that initial doses will be so limited that we need a level of sub-prioritization within these groups? And how complicated is that to figure out and enforce in a matter of really days until we get going here?
It's really tough. I mean, I explicitly will not talk about my institution, but the larger ethics issues, and going on the public information that's available and what all institutions are facing, you can see real troubles. No large academic medical center that I'm aware of expects to receive the full dose that all of their first top tier people would require to get started on that first dose. So everybody is really going to be thinking like, okay, frontline health workers, that's a much larger group than we'll be able to treat in the coming week, and maybe even in the coming weeks. So there are a number of different responses. You could do within the high priority batch, you could do random allocation, so a lottery. That's not unfair. You need to make sure that everybody actually is equal in there. Very careful attention to the definition of frontline worker. In some academic work that talked about prioritizing ventilators and the like, which is a different allocation scheme, people said, well, you want the people with the most training because they're so hard to replace. So this, from my point of view, is an egregious ethical error. All lives are equal. I like smart people. That's great. Years of training don't necessarily tell me if you're smart, and it certainly doesn't tell me if your life is worth more. So I think that frontline worker and healthcare worker has to be very inclusive of people who face risk, absolutely not based on medicine's very obvious hierarchy. It's a very hierarchical field that sort of worships people with 12 years of fellowships and that kind of stuff. So we don't want that. We want the employees of an institution to feel like if I take risk because I clean the ICU or because I clean the emergency room, that risk is respected and my work is respected. The same whether somebody's an MD, PhD, or whether they are part of the environmental safety group at the hospital. So that I think is really tricky. You've got to be careful how you define frontline worker. Can't be just MDs, absolutely. And explain to people what will be your allocation scheme. Is it going to be random within your top group? Or is it going to be some other thing? And there are a lot of other things that are probably not a good idea. You don't want to ask people if they have health conditions that make them more at risk, because as an employer, you don't have the right to know that. You can't ask that. You certainly can't go around saying, hey, are you pregnant? Because I'd be really worried if you were. Like, yeah, like ethical red flag, it's against the law. So we do need to figure out, how can we be just? How can we make sure that we are not doing things in an elitist and unjust way? And what can we tell people about what happens after the first batch? When will you get yours if you're in the top priority? So I'd start with that.
This is something I'm watching really closely as a reporter, is the fairness of the process. And if we see people who can jump the line, and I wanted to get your thoughts on, one group. I think there's arguments on both sides of this as far as, should a group of celebrities or prominent people get the vaccine early to instill a level of confidence. There's this idea that these are, to some level of Dr. Fauci. We've seen the former presidents line up with Bill Clinton, George W., Barack Obama, all say they would get the vaccine in a public setting. And I'm wondering, even more within the healthcare institutions, the CEO of an institution that might be able to do their job remotely and is more, working on the next merger deal than they are caring for a COVID patient. What do you think about that? Good or bad idea for, the CEO of a healthcare institution or to prioritize some doses for influential people who might not otherwise get them early on?
With every policy, there are the intended consequences and also potentially huge unintended consequences. So if I were a CEO, I'd be worried. I'm not saying it's right or wrong, but you have to think about what is the message that you're putting forward. The message you want to put forward is not, I'm at the front of the queue because I'm more important than you, or because I can access stuff that's not available to you. That's not what you are trying to tell to your people. If, on the other hand, Beyonce or Oprah, incredibly trusted figure, and I'm specifically thinking of African-American really trusted figures, because there is a very understandable hesitation based on, unfortunately, very accurate depictions of the African-American experience historically in healthcare in the US. So I'd be very sympathetic to have a revered African-American public figure step forward and say, I'd be happy to do this. Because I think the message then is not, I'm stepping to the head of the queue, but I think that this is the right thing to do, and I invite you to come and join me here. So I think, careful about ways that things can be misinterpreted, and it's tricky. Years ago, in the anthrax scares, Congress was trying to decide what kind of medications to recommend because the anthrax was being sent in the mail. And they decided for the postal workers who were being subjected to anthrax because it was going through the mail, that they should get the generic antibiotic, but for themselves, making legislation in Congress, they weren't really feeling the generics. They were mandated for themselves the more expensive version of the drug. I have no idea if there's any difference in efficacy, but I can tell you that they were spanked for that messaging. That really didn't work out well. So be careful when you're figuring out, if you are at the front of the queue, you're in charge, make sure that people don't see you as taking the biggest portion first because you can. It's not a good message.
I did not know that about anthrax. That is astounding. Yeah. And I can tell you, I just read Catherine Eben's Bottle of Lies book about generic manufacturing quality. And the thesis of that book is that there is a difference there. So that doesn't seem to be an innocent mistake by any means. This has been really fascinating. I wanted to prioritize audience questions. I could go on, but I'd rather just go grab bag style. We're going on the basis of thumbs here. So Michael Malchiodi is asking, has anyone heard anything about whether the CDC has put out any guidance if they recommend that people that have already had and recovered from COVID-19 get the vaccine? Anyone hear anything about people who have had COVID, recovered, and whether or not they should get a shot?
This is Louise. Yeah, anyone else jump in, but I think it's an unknown, to be honest, because I don't think we know if you've had COVID how long your immunity lasts. And so that natural immunity also may be very different than the vaccine-induced immunity. So I have not seen any recommendations yet, but if I had to guess, I would say that probably people who've had it should take it, as well as people who haven't had COVID.
I think the CDC messaging is pretty clear on this right now, in that the natural antibodies that you would get in actually getting the disease or the infection, the risks are much higher associated with that than with getting the vaccine right now, objectively.
I would add that there were quite a few false negatives in testing. So there may be people who had COVID and the testing showed they didn't, or they didn't have COVID and they thought they did. So it's not 100% easy to know who did and didn't have COVID, actually. So in general, if you're high risk, if you're a frontline worker and the vaccine's available to you, my personal advice would absolutely be to take it.
Yeah, we'll see if we get more data on it, but there certainly hasn't been any major safety concern that would suggest to deprioritize yourself if you're in that role. We have another question from Tanja Dodd. Based on Susan saying doctors are key influencers, if health departments are getting the vaccine first and not an individual's PCP, how do we convince employees to listen to the health department staff versus their own PCP? I guess because that mentioned Susan, if you want to start.
I was actually hoping you would go to the real doctors on this question.
We can open it up. Anyone?
Well, I'll just comment quickly. I just finished teaching a master's level class on pandemic bioethics, and my students are mostly health professionals, or a majority of them are. One of my students was an oncologist, and she was saying, for my living, I pump unbelievably toxic chemicals into my patients, and we're on it together, and they're all for it, and they're totally happy to take that risk. When I tell them you're immune compromised, I'm going to give you the flu vaccine, they go, what, are you crazy? That's full of terrible stuff. And she's bangs her head on this. She can't understand that you'll let me put this stuff is going to make all kinds of terrible things happen to you into your body, and you won't take a flu vax. So I'm glad that the survey data says that people trust their physicians. I don't, unfortunately, think that's true in every case, and that as I was saying earlier, our beliefs are not always data-based. And so we need to think about, what is it that I could do to make you feel that this is the right choice for you? Is it information? Do you want to see me take it? What would help you feel safe doing this for yourself? Would you do it to protect your family? What would be the motivator for you? Let's talk about that. But basically, motivational interviewing, I think, is going to be necessary. And we need to have like a little crash cheat sheet for primary care doctors to help them figure out how to do that.
Yeah, I would totally agree with that. And I think public health messaging is going to be key. I don't know if there's going to be a national public service announcement campaign or things like that, but I think those messages are very important and can be influential. But I think also, to the point that Susan made before, people tend to do what influencers do. So, if they see their friends getting it, if they see, influential people like Oprah getting it, I think that's very critical in people's decision making.
And I wanted to move to a question from Jennifer Wilson. Jennifer asked, will the vaccine be producing asymptomatic people walking around spreading the virus after administration? This is a personal, I've been covering the story since July. I've written various iterations of the same story of the idea we should set the expectation at you get the vaccine and we keep wearing masks and we keep social distancing. In conjunction with those measures, that will tamp down the spread of the virus over the long run. These studies weren't designed to measure asymptomatic transmission or viral shedding. Basically, if you run a large study, you got to pick one thing that you want to answer really, really well. In this case, that was preventing symptomatic COVID-19 disease. So it remains kind of an open question. If we're knocking down cases from the symptomatic level to asymptomatic, where you're unwittingly going around carrying the virus, potentially spreading it to others, we don't know. So that's at least my take, and what I've heard from a lot of vaccine developers is exercise caution for the time being. Hopefully we run some trials in 2021 where we can get a better sense if these vaccines actually can tamp down transmission or viral shedding. I don't know if anyone has anything to add on that.
Just to jump in, Andrew, I completely support everything you said. And I'll add that I am particularly interested in the health of older people, and particularly people with dementia. So that group is being prioritized to receive the vaccine early, certainly for people living in nursing homes. But we don't really know whether or not that group will be able to respond to the vaccine. Typically, that group does not respond all that well to the flu vaccine. So I'm really worried that people, particularly healthcare providers, will think, I've got the vaccine, I don't need to use protective equipment. Certainly for people who are family members who might try to visit older persons in a nursing home, or certainly for people who work there, please don't think that having the vaccine means that you can no longer be a carrier toward that extremely vulnerable older person living in a nursing home. We just don't know if the vaccine will do anything for them.
Yeah, I'd say that's such an important point. That was actually when the CDC had their advisory committee meet on prioritization, there was one vote in dissent, and that voter was bringing up that there was just not enough data on the elderly for them to sign off on this plan. And I would mention that new data this week from Pfizer showed their study, about 40,000 people. You had about 20,000 who got Pfizer's vaccine, right? And there's about 800 who were above the age of 75. The max age on that was 89. So there hasn't been a single 90-year-old plus enrolled in Pfizer's study that we have data on. That kind of stuck out to me when we saw the news from the UK that the first person to get it was a 90-year-old woman. That's going out. There's a level of data-free zone there. We can extrapolate from what we have from the study, but I think that's very, very important to level with the people about what this study did and didn't do. So I'm glad you brought that up. All right, let's see here. We got James Stevenson. Given the prioritization for the vaccine, will employers be able to organize vaccination events at the workplace? Maybe that would be going for Andrew. What have you heard anything about that as far as can employers sort of set this up? We think of flu vaccination clinics. You can have it in your office. Are we going to see a similar thing here?
Andrew, from the employers that we're working with, we haven't heard definitively one way or the other on that particular question. I'd be interested in, Dr. Short, what you may have heard given your conversations with many more employers than the ones we're having.
Yeah, so it's a great question, and we get asked about a lot. We've had discussions with CVS, Walgreens, and some of the other big providers that do flu shots, and I think that they're all gearing up to do employer-based programs. When they will be able to do that, when we'll have enough of a supply, I don't know. But I suspect we're going to see very quickly a myriad of employer-based solutions in the marketplace. And one of our jobs is to keep up with all of those solutions. So I'm looking forward to that. It'll probably be a challenge, but I do think that we will see, vaccination clinics similar to flu, on-site flu vaccinations for employers. It's a great opportunity for employers, for employees, and obviously it's a great opportunity for those who administer the vaccines as well. I think the key issue is going to be how are they going to, since all of the vaccines that are being developed now, or the majority of them, except for J&J, that are close to coming to market, require 2 shots. And so the question is going to be, how are they going to ensure compliance with the 2 shots? Would they have to have follow-up clinics and those kinds of things? And I don't think we know. And certainly employers who have on-site clinics are looking to potentially leverage those because they're already existing. And they're looking at their vendors, their carriers, their PBMs, or other health vendors that they might have to see what solutions or options are they going to have for flu vaccine. For COVID vaccine.
And I've seen multiple questions here. I'm going to go with one version of it here from Christy Clark. Can employers require the vaccine to keep their workforce safe unless they have a medical reason or religious reason not to via affidavit, kind of going beyond just a mandate, thinking about what they can and cannot do. Maybe that's going for you again, Luis.
Yeah, so I would say each employer has to consult, their legal counsel. And there is a difference, as I said before, between requiring an emergency use authorization, medication or vaccine, versus something that is fully vetted and has regular authorization. So, I think most employers are thinking now that they probably can't require it, but they can provide a lot of information and encouragement about the vaccine. The exceptions might be in places like healthcare, where they're taking care of other people, they're saving lives, and so I know some hospitals and healthcare organizations do require, for example, flu vaccine as a condition of work. So I think the answer is unknown, and I think that it's probably not going to be something that employers will be able to do for EUA, but perhaps something to think about as if when they get full authorization. But again, consult legal counsel.
I'll just add, I completely support what Dr. Short was saying, but I'll add that in the healthcare setting, it's unclear to me that you'll be able to change what protective equipment people need even after they've been vaccinated. So I'm not really sure what you would gain by telling people that they're forced to do it. You're not going to send a nurse into the neonatal ICU without protective equipment because she's been vaccinated. That's not happening. So I think you lose a lot of goodwill from your staff, and I'm not sure really what you gain in doing that. That's just a personal observation.
I agree. I think it's better to give people choice and a lot of information and access and remove barriers. That's probably a better way to go about it.
And then I'm going to take this question from Michelle Jarasek and kind of segue into, I hope to do this kind of in a lightning round level of either overrated or underrated from you as far as some of these hot topics. But Michelle asked, do you see the need for having proof of vaccination being given for doing everyday types of activities? For instance, mandating showing proof of vaccination to being able to go certain places. I kind of summed this up with the idea of a vaccine passport. And I think we had a similar debate that was very theoretical about antibody testing and could there be an antibody passport? And I never really understood that. And I think this one's more interesting, but I wanted to go around. I mean, what do you think? Is this, are these topics getting too much attention? Not enough? Is this realistic? The idea of vaccine passports?
It's protected personal information. It's that falls solidly under the HIPAA law, which says what people are and are not allowed to demand from you. So I'm not sure you'd get away. I mean, I'm not a lawyer, so I can't speak as an expert on that, but it would make me uncomfortable ethically, and I'm not sure that it will fly legally unless there's some federal law that can override HIPAA, which is a heavy lift. So
is it if a private business does that, I'm thinking of a concert venue asking for that, that seems like a violation of HIPAA.
Well, you're allegedly voluntarily giving them the information, so you can disclose if you want to, but it's
they can't bar you though. That would be the only way to have benefit, I guess, is the exclusion ability, which that feels legally murky. Yeah.
You might be excluding somebody from your public access venue on the basis of a health condition. So if you have an allergy that means you can't get the vaccine, maybe you could have a sort of get out of jail free card saying I have a medical reason, so I don't have to have the vaccine. But then you're really getting pretty complicated.
Yeah. I see we have 1 minute left, so I'll just squeeze in one final question to get the most out of this we can. It is another one just kind of for the panel. Overrated, underrated, the freezer challenge. This is one thing we have not talked about. Pfizer's vaccine needs to be kept at about -94 degrees. I think there has been 3 million news stories written about freezers and the need for them. And I've talked to Pfizer. They are very confident they're shipping this in a box. You can keep it in the shipping container. It's specially designed. You refill it with dry ice. It'll stay stable for 30 days, which should be enough. So you don't need these special freezers that everyone has written about. But I'm wondering from you, what are you hearing out there? Is that a major concern or not? Anyone?
I think I thought people would think of it as more of a major concern than what I'm hearing it is. And I think, the supply is so limited that if there is a solution to the cold chain storage issue, which it looks like Pfizer has one, then I think people are less worried about it, to be honest, because the supply is very limited. I mean, and Moderna will come along hopefully in the next week or two and get authorization as well. And they don't have the same kind of cold storage issues. But again, even between those two, it's very limited. So I think people want whatever vaccine they can get, and they're going to deal with whatever storage issues they have to. And Pfizer's trying to, solve the problem and make it easy for people.
I think they're planning to use it before those 30 days are up anyway. Why do you need it in such a hurry if you're going to sit on it and just think about what to do? I mean, it's like,
I don't know if my question biased it to that direction, but that's at least my amateur thoughts. Anyway, we're at time. Thank you so much, Tia, Andrew, Sue, Luis, for joining me for the hour. And thank you to the few hundred people that tuned in to listen. Really appreciate your time and sharing all your info. So with that, I'll kick it back to Health for, I believe, a magician acts.
Thank you, Andrew, and to all of our panelists. If you'd like to continue the conversation, please join us on Twitter. And now, please welcome mentalist Mark Tolan.
Hey there, everybody. My name is Mark Toland. I am a mind reader. Looks like we got some people staying on screen. Perhaps Andrew looks like, and Susan. Hi guys. Hello. And Louise staying on. Oh, fantastic. Hi, nice to meet the three of you. And Tia's gonna stay on. Fine. The more the merrier. This is great. So look, I am a mind reader. I'm coming to you live from Chicago right now. Excited to do this. Happy holidays to all of you. In our short time together, I hope to maybe show you some amazing things through the screen here. But I want I've never met Susan or Louise or Andrew or Tia before, so we'll see how this goes. I think maybe just since we got the four of you, we'll just kind of jazz something real quick. And I want to see maybe if the four of you can maybe pick up on a thought that I'm trying to send you. So if you would all unmute, that's fine. You can unmute. I've got a pack of cards here. In a moment, I'm going to see if the four of you can assemble a card as a group and perhaps guess the card that I am thinking of. So just like 2 minutes ago, I took one card out of the deck. I turned it over. I put it back in facing the other way. And the goal now is for the four of you to assemble this card as a group and guess that card. So we'll start with, let's see on my screen, we'll start with Tia. Tia, is it a red card or a black card?
It's obviously a red card.
Obviously, okay. And then to Louise, is it a heart or a diamond?
It's a heart.
It's a heart. Okay, interesting. Louise, should we talk to Andrew next or Susan?
Susan.
Okay, Susan, it's a heart. So is it low or is it high?
High.
High. Okay, so we have red, we have heart, we have high. Andrew, to you now. Put it all together for us. 8, 9, 10, Jack, Queen, King. Those are all the high ones. Which one is it?
9.
The 9 of hearts. Okay, so you all put this together, and I like doing it this way because obviously if you just blurted a card out, you might say Ace of Spades or something too obvious, right? So 9 of hearts feels random to me, and obviously you guys didn't know what to expect either. So here we go. I'll be very slow and very fair, but I want you to see in the middle of the deck, there is one card and one card only, as promised, facing the other way. And that is the 9 of hearts.
Awesome.
Wow.
Not too bad. Pretty good for a warm-up. So if you guys might have your phone nearby, or sometimes people have an actual calculator, either one is good, but pull up the calculator function there and wave it when you got it. Keep me honest on my math. I'll get mine up here just so we have it, and make sure it's cleared out. There we go. Everyone got a calculator nearby? Perfect. Okay. So we'll go in reverse order now. So Andrew, talking to you first, give me a number. Actually, let's make it specific to you. Give me the month of your birthday, just the month.
9.
9. Okay, September. So we'll do 9. Everyone hit in 9. Keep me honest on math. So we go. If you're off screen now and just watching, you can do this as well, just to make sure we're all on the same page. We'll do 9. We'll hit times. Back to Susan now. Susan, what day of the month is your birthday? So not like Monday, Tuesday, but the number, right? So I'm the first. What about you?
17th.
17th. Okay, so 9 times 1, 7. Hit equals. I'm showing this number, 153. So far, so good? Very good. Okay, so we'll hit times. Let's go back to Louise now. Louise, we need a 3-digit number. Any 3-digit number you'd like.
196.
196. So we'll do times 196. Everyone hit equals, getting bigger and bigger now. Here we go. 29988. Yes, I see some nodding. Very good. Let's hit plus. Now everyone hit plus, whether you're on screen or off, hit plus. Back to Tia now. Tia, we need a 4-digit number now. So let's do a year that's special to you. It doesn't have to be when you were born. Any special year, it's up to you.
2020.
2020. You're the first person all year to say that, honestly. So plus 2020. There we go. And we'll hit equals. There we go. 32008. And then Tia, we're going to do one more. So pick one of the other 3 there to send it back to. Who would you like?
Let's pick on Sue.
On Sue. Okay. So we'll hit plus. Everyone hit plus. And then Sue, I just need a zip code. It doesn't have to be where you are now. It could be anywhere that you know, but 5-digit number now.
90210.
90210. Excellent. Okay. So plus 90210. Hit equals. How we doing so far? Everyone got the same number? 122218. Great. Just having you confirm me here. Now, just hit minus. We'll make this random and come full circle here. We'll hit minus. I'll look away. I'll just type in a couple numbers here. Great. What do we have? Okay. Minus 1098 to make this extra fair, and then hit equals. This is what I'm showing now. Yes? Okay, very good. So of all your numbers coming together and a few random numbers, 3-digit, whatever, personal information from you guys and random combined to make this number, I think for me, back in March, I lost like all my work. I do live entertainment in theaters for the whole year and then embraced this virtual world and have been able to like get in here and do a lot of these events. And what I found, a bright spot for me this year, is this connection, right? It's not Netflix or YouTube. We're actually connecting through the screen. So at least you have to participate. And that means that every time I do this, it's unique, it's special, it's different, right? So I did a show last night, very different from you all because it's what they bring to the show. And later tonight, when I do another show, it'll be very different from you all as well, because it's about people, it's unique. That also means that these numbers that you bring are unique because they're special, from Susan and Andrew and Louise and Tia, all these numbers combined to make this total. So that means it can't just be a random number. It has to be special to you all here today. So that is not just any number. It's actually 12. That's December the 11th, 2020. That is today's date, the date of this webinar happening right now.
Impressive.
Not
That
too
is.
bad.
That happen every time? Do you always get the day's date?
Tia, I'm a professional. I am a professional here, okay? Do
That's
not doubt
cool.
the mind reader, Tia. Come on. This is my 4th health event. I think they keep having me back for a reason. Come on now. Louise, did you have your phone there? I think I might have seen you waving it around.
Yeah, I got my phone.
Would you mind pull up the internet for us? Go to the internet. We're going to go to Google though, but I want the stats page. So go to this page here. Okay. It's Google-stats. This is like worldwide trends. I'm going to have you use this to make a quick selection. Okay.
Okay. Hold on one second.
Yeah, no problem. And then once you're there, just because we're in this virtual world and it's kind of strange, would you just hold that up to your camera there so everyone can see and they kind of feel part of this so they know what this is and what you're dealing with?
Sure.
It'll say something like explore what the world is searching or something. Perfect. Yeah.
Like that.
Great. Now, obviously, the top ones on the list, Louise, are going to be very obvious. It's whatever is on everyone's mind, probably things you guys were just talking about, as well as other things like holidays and football and who knows what else. So I don't want to do those because it's too obvious. So scroll way to the bottom, and you'll see a bunch of little categories, some icons, right?
Yeah.
Okay. Click on animals. We'll do a quick demo so everyone can see what this is. Just kind of the virtual way of doing things here. And then you can show everyone one more time, Louise, once that loads, what the animals page looks like.
Yeah, it says interest by region.
Perfect. Yeah, so this is people are looking up different animals, different searches. Louise, give me a number up to 100. Any random number up to 100.
72.
72. Okay, I like it. So 72. Why don't you scroll down to the number 72? Go all the way down and then tell me randomly what would that animal be, just out of curiosity.
It's a bear.
A bear. Okay, perfect. Okay, I just have you do this, and I appreciate you indulging me. Just as a quick example for everyone so you know how this works. Obviously, these animals are all different, and it's always changing because people are searching different things on Google. So keep scrolling past the bear, and then get back to the bottom and click on household. And this is for all the marbles now, because I chose this category because I've been trapped inside my household all year long, essentially. And I was thinking about this show, how do I transition from stage to virtual world? And the more I thought about it, I looked around, I was like, oh, it'd be cool to use household items. It seemed like mine were very suspicious. And then the more I started doing these shows, it felt like it's very suspicious to use certain people's, because people instantly doubt me and are skeptical about what I do. That's where I came up with this. These are Google Trends. So we'll use whatever is next to 72. Scroll down to your number. That'll be like our group object, our group item today, whatever that is. So what is number 72?
Number 72 is spork. Spork.
Sorry?
Spork, S-P-O-R-K, which looks like it's a spoon and a fork.
Right. A fork. Okay, very good one. Okay, a spoon and a fork. Okay, everyone remember that? I just had you do that quickly while your phone is out. I'll get to that in a moment. But before I do, I'm going to try and experiment with the other three all simultaneously. So Tia, Susan, and Andrew. Using this, I got some cards, I got a glass. We will get back to the spork, so don't forget, Louise, I'll ask you in a moment. We'll use this here. So starting maybe with, just looking at my screen here, let's see. We'll start with Susan, we'll go to Andrew, and then we'll end with Tia. I think that's the order. So Susan, could you think of someone you know, friend, family member, someone close to you, just a first name, someone I couldn't possibly know? You have someone in mind?
I do.
Okay, so focus on this name now like you were going to say it. Don't tell me, but okay, good. I'm going to go with something. I'm going to go with something like this for you. Just commit to my instincts here. You're going to be number one. So everyone watching, remember, Sue is number one. We will get back to this. For now, I will leave this right down here inside the glass. Hopefully you can see that on screen. Yes, very good. Okay, so Sue, would you tell everyone what was the name you thought of?
William.
Perfect. Okay, everyone remember that. We'll get to that in a second. Now down to Andrew. Andrew, let's do something opposite of this. Let's do a location, but instead of somewhere you've been, let's do somewhere you'd like to go. So literally anywhere in the world. Remember traveling? You remember what that was like, Andrew? Picture going to like a location, anywhere in the world, city, landmark, whatever you want, any destination. Do you have something in mind?
Yeah, I do.
Okay, and be honest with me, is it somewhere I would know? It's not like a tiny town somewhere. It's somewhere I would know.
Yeah, you would know. Yeah.
Okay, good. I won't be able to get it if you stump me like that. Okay, so focus on this place now, like you were going to say that. Very good. Okay, this would be excellent. I will go with this. You're going to be number two. I'll lock that in here. You are number two. Very good. I will leave that down here. So we are committed. Andrew, what was the location you thought of?
Croatia.
Croatia. Interesting. Okay, everyone remember that for Andrew. And last but not least, back to Tia. And Tia, the reason I saved you for the end is we were just doing a couple of experiments, and I actually think we're kind of in sync. So I have a feeling about what you're going to do before you even do it. So I'm going to lock this in for you as kind of a little prediction here, a little guess before you do anything. You're going to be number three. So I will lock that in as number three. So there we go. Those are my guesses there in the glass. I am committed. I'm locked in. For you, Tia, it's kind of psychological in a way. It does use these cards from earlier, and you can see, again, all the cards are different here. But since I can't hand you the cards and have you do this, which is what I might do in normal times, I'm going to just deal them slowly onto the glass. So I'll set one here like so. I'll go through all the cards very slowly. Whenever you want, just say the word stop. And Tia, it's genuinely up to you, so I'll just go through and just say stop whenever you'd like.
Stop.
Right here. Oh, I had one in my hand. Okay, very good. The seven of hearts. The seven of hearts. Okay, so look, if you'd gone one more, we'd have a different card. Or if you'd gone one less, we'd have a different card, right? Point being, there's a lot of cards to choose from, but you ended here. So let me grab yours out of here. We'll just stay with you on this. Number three. I did this before you did anything. You will see that you nailed it. That's not too bad, Tia. That's not too bad. There you go. Perfect. Perfect. And then back to Andrew. Andrew, you were thinking of a location. You were number two. So there is yours. Andrew, what was the location?
Croatia.
Croatia. This is what I went with for you.
What?
Fantastic. And last but not least, back to Sue. And Sue, you can see yours in there. I'll be very slow, very fair here, just so you know. Just don't want to fall out of view there. But there's yours. I was not quite sure about this, to be honest. But what was the name?
William.
William. Okay, that's what I went with.
No way.
Yeah.
Oh, it's William. That's perfect.
Wow.
Guys, thank you so much for helping out today. Before I log off and we call it a wrap here, big thanks to Health for having me. And again, happy holidays to everyone on screen and everyone else watching. We have one piece of unfinished business. And Louise, of course, that's your choice. You chose something from worldwide trends, our kind of group object. I remember because it was funny, but just say it again so everyone knows.
Spork.
A spork, a spoon and a fork. Interesting. I put a little card back here. I wrote you a message. I think you'll find this interesting.
Oh my God.
It had to be spork, Louise. It had to be. Guys, thank you so much. Have a great rest of your day.
Thank you.
Thank you. That was fun.
Thank you, Mark, and to everyone
Yes.
who joined us. Have a great rest of your day.
Thank you so much.